China is experiencing a massive surge in coronavirus cases. An epidemiologist and health economist, Eric Feigl-Ding, informed that hospitals are completely overwhelmed in China. The epidemiologist estimated that more than 60% of China and 10% of Earth's population are likely to be infected over the next 90 days, with deaths likely in the millions. According to a Wall Street Journal report, one of Beijing's designated crematoria for COVID-19 patients has been flooded with dead bodies in recent days as the virus sweeps through the Chinese capital, offering an early hint at the human cost of the country's abrupt loosening of pandemic restrictions. Feigl-Ding said, and I quote, "The Chinese Communist Party's goal is to let whoever needs to be infected, let whoever needs to die, die. Early infections, early deaths, early peak, early resumption of production," he said. China has reported no COVID deaths in Beijing since the authorities announced 4 deaths between November 19th and 23rd. Moreover, the deaths in mainland China is being hugely underreported. Through a survey of hospitals, funeral parlors, and related funeral industry chains in Beijing, it is known that there is a recent explosion in funeral services caused by the sharp increase in deaths. According to the epidemiologist, the cremation in Beijing is taking place relentlessly. This month, China halted much of the lockdown, testing and quarantine regimes that backed its zero COVID policy for the past 3 years to subdue even small outbreaks of the virus. Because of the lifting of testing requirements, the scale of China's coronavirus surge has been hard to measure. Daily national case counts have steadily fallen as fewer people test themselves at public facilities, and health authorities earlier this week stopped releasing daily tallies of asymptomatic cases for the first time since the pandemic began. The Wall Street Journal report further said that earlier this month, the Beijing Emergency Medical Center urged only critically ill patients to call for ambulances, saying that emergency requests had jumped to 30,000 a day from an average of about 5,000, straining the capacity of paramedics to respond. According to National Health Commission regulations, corpses diagnosed as COVID positive or suspected of being COVID positive must be cremated immediately in specially designated furnaces with no dressing of bodies or memorial services. But as per reports, several people in China remain vulnerable to the virus because of limited exposure, low vaccination rates, and poor investment in emergency care.
Subscribe to Oneindia channel and never miss an update.